Hi everyone, this is Dr. Shantanu Gulati and the title of this video presentation is Preventing Small Pupil Complications in Cataract Surgery, my 4 pearls using the Bhattacharjee pupil expanders, the BHEX and the BOCTA. A 23 gauge forceps is used to engage the expander flanges under the iris. However, in small pupils and especially with the BOCTA, where there is a greater discrepancy between the ring size and the pupil size, a bimanual technique becomes extremely useful. As you will see across these clips, one hand advances the flange with the forceps, while the second instrument, usually a blunt Sinskey, supports the iris from the opposite side. This provides counter traction and even avoids the need for pupil stretching with Coughlin hooks before ring insertion, because the expansion happens naturally as each flange engages. In many cases, such as those with dense arcus senilis, or when using the BOCTA, the final flange may lie hidden under the limbus. Blindly searching the periphery risks iris trauma or even descemet membrane detachments. Instead, treat the iris ring complex as a single mobile unit. By gently pushing the opposite visible flange iris unit towards the limbus, the hidden flange naturally moves centrally, where it becomes visible and can be safely engaged. Once the ring is in place, the pupil provides a stable and adequate diameter for the capsular axis, all the steps of phaco and cortex aspiration. This controlled working space greatly reduces the risk of complications in small pupil cataract surgery. For IOL implantation, the key principle is dialing the lens into the bag without allowing the ring expander to subluxate behind the optic. This is achieved by using a controlled dialing movement that causes gentle flexion at the leading haptic-optic junction against the capsular equator. This maneuver creates a small space between the trailing haptic and the ring, preventing the two from contacting each other. With this controlled flexion and spacing, the IOL slides smoothly into the bag. The fourth pearl, especially important for surgeons using these rings for the first time, is understanding post-operative iris behavior. A thin atrophic iris may present on post-op day 1 with a pupillary membrane or an irregularly shaped pupil. This should not be discouraging. With appropriate steroid and dilator therapy, these pupils typically settle into a smooth acceptable shape within a week. In eyes with a healthy iris, even post-op day 1 pupils can appear round and aesthetically normal. With these pearls, surgeons new to the Bhattacharjee expanders can adopt them confidently and safely in small pupil cataract surgery. Thank you.